This has been a tremendous experience. When we first sat down to plan this out, we looked at this as an opportunity to educate people about population health, not honestly fully understanding what that meant. And over time, I've grown to appreciate the people who are sitting at this table, helping us think through some of the more complex problems and coming up with solutions that I would have never have thought of.
Whereas infectious diseases were the gravest health threats of an earlier era, the largest killers of our time have become chronic diseases such as heart disease, stroke, cancer, and diabetes, for which the leading risk factors are obesity, physical inactivity, poor diet, and smoking. Chronic diseases account for 60% of all deaths in the state and were estimated to cost the state $6 billion each year. Chronic diseases are among the most preventable of all health problems. We learned early on that we did not have enough data and information about chronic disease and health priorities across the region. Each of the 5 counties had a clear picture of their respective community, but needed to better understand the health issues and priorities in the other counties. This would allow us to identify common areas to focus our collective efforts, leverage knowledge and resources across the region, as health problems do not stop at county lines, and to engage communities as co-producers of their health outcomes. Our group initiated a health and wellness assessment and gap analysis of our 5-county region, which yielded a report called Planning for Public Health, a Regional Assessment for Creating Healthy Communities. This report includes a variety of information and maps necessary to better understand our communities and their priority needs, as well as strategies for improving public health in the region. The report also identified resources to support short-term strategies aimed at increasing availability and awareness of diabetes self-management education. It explored a framework for accomplishing regional health assessments in a way that provides communities and health entities with current just-in-time data. It also accomplished a food system assessment that would complement the Planning for Public Health regional assessment and serve as a guide for partners and communities interested in addressing healthy food systems in the larger context of supporting healthier communities and decreasing the burden of chronic disease on our health. Data from the food system assessment could also contribute to identifying evidence-based strategies for healthy eating. Both the Planning for Public Health regional assessment and this food system assessment will serve as valuable resources for grant opportunities. Specific actions in the support of these strategies include funding training for the public health workforce to provide diabetes self-management education to communities in our 5-county region, engaging the clinical provider community and promoting diabetes self-management education opportunities and resources for them to provide patient-client referrals, engaging communities raising awareness and promoting these same resources for their access, leveraging technological innovation to promote diabetes prevention, management, and available resources, and initializing an asset map of evidence-based interventions and strategies that address the prevention and management of diabetes, obesity, and hypertension, which can be used by communities, and to identify gaps in programs and services and allow for targeted strategies to address these gaps.
When you think about it, our health is determined by many different things, some things that are within our control and some things that are outside of our control. When we step back and we asked ourselves, how do we engage our patients to take more control of their health and well-being, we needed to understand what they were thinking. Our group believes that when an individual is engaged in their health and health care, this will positively impact some important population health indicators. So take, for example, our infant mortality rates or our life expectancy. When a patient is engaged in healthy behaviors or able to control some aspects of their health and well-being, these indicators will move in a way that demonstrates a healthier community, a healthier region and state. And so our group was tasked to figure out, from an individual's perspective, what they can do to take control of their health care. So when they're told that they have a particular disease process like high blood pressure or chronic lung disease, what are some things that they can do to make it better so that they're not only dependent upon medications or simply the advice of the doctor, but what they can control, choices they can make to make their lives better and ultimately impact the lives of generations to come. Through this process, we learned that we couldn't bring our own solutions to the table expecting this will fix the problem. We learned that we had to take a step back and ask people what they needed, what was important in so far as to improve their willingness to engage in healthy behaviors or healthy activities. When we looked at it from that perspective, we quickly realized that we needed to get groups of people from different generations to ask them questions about what makes them engage in their health and well-being. And so when we did do this, we collectively asked ourselves what questions would be important that would help us to understand how we can create a better system of care that addresses a patient's or people's needs and serves our community and region. So some of the questions we brought forward were, who's in charge of your health? And what are the barriers to accessing health care? And how have a person's views changed over time? What were the tools or resources that one uses to engage in healthy activities or make healthy choices? And what does patient engagement mean to you? And how do you think about making healthy choices and what goes into your decision-making process?
So our group was tasked with helping people find ways to have that conversation about end-of-life care. It's a scary topic. Lots of people avoid it. And we were tasked with coming together to figure out if there's a way to make it easier for people to have that conversation so that their end-of-life wishes are done appropriately the way that they would want it to go. We just need to give the gift of removing the burden of making healthcare decisions. We need to give that gift to our family members and our loved ones and take our own, healthcare and our own power and document that. And it removes the burdens from your family and it helps the healthcare community, those providing the healthcare, to know that they're providing the highest quality of care to the patient that they wanted. So I think it's also a gift to the healthcare providers as well. And so it was what we kind of learned as we were all talking about what we wanted to do to get this conversation out in the community was that there was already a program that Laura Kafer Hospice and Life Care Center had created called Begin the Conversation. So we're all really excited that the product was there. It was kind of a huge leap forward that we didn't even have to start creating it. And so we were able to utilize what had already been started in the community, and then we came with a lot more ideas and some of our own resources and worked on ways to take that and continue to push it out throughout the community. So that was the exciting part, was that there was already a big step forward in the community on this. One of the really big things this group wanted to do was create some sort of big event for National Healthcare Decisions Day, which is April 16th. And so we came up with lots of ideas and suggestions, and Laura Kafer Hospice has taken BTC as a result of those suggestions, and on National Healthcare Decisions Day, they're going to be at over 50 locations throughout our region, and they're going to have volunteers talking to everybody that passes by about what advanced directives are and how to go to begintheconversation.org to learn more about them. So we took this existing Begin the Conversation program and we came up with ideas that we would like to see it more, utilized throughout the community. And so we offered some constructive feedback to the people that owned Begin the Conversation and the group asked how they could be a part of expanding it. And so what we did was we came up with the idea of creating Train the Trainer programs so that throughout the community we could train people on how to utilize Begin the Conversation to then go into their own agencies, organizations, and churches and train people on beginning the conversation.
Well, our role was the role of the employer in employee health. So when we think about where the employer feels a need when talking about healthcare, and especially in this region, there's not a lot of employers that really take this seriously. And so our role is, how do we reach out to those employers and really see what kind of impact we can make as a group so that we can enhance the wellness in this area from an employee standpoint and help drive some healthcare costs down a little bit if we can make a dent. Well, I think we learned that we have challenges, every day, including myself. I'm in the wellness business, so I think the challenge was, how do we reach 5,000 people without putting so much effort, within our small group to do it? So we were thinking, in the beginning, we had all these great ideas and they all sounded excellent, but how do we implement it? So the hard part about the whole process was, okay, how do we take the next step? Everybody had these great ideas and programs and services within our group. How do we actually take it to the bigger population? And so not a lot of us were in the real, nitty-gritty of human resources. So as soon as we actually learned of this new group that we're going to be implementing it through, the Lower Cape Fear Human Resource Association, bingo, lights went off. Here's a group that we can actually reach 5,000 employees. So once we reached out to them, everything kind of fell into place, and now we're actually on the right track. Yeah, the Lower Cape Fear Human Resource Association, really their role is to provide education for the Cape Fear region human resources. So it could be anything and everything, that related to human resources. So every month they have a meeting that people can register for if they're a member of this association, and it runs across the gamut of topics, anything related to, just employee benefits or, just dealing with people. I mean, it's across the board. So they really haven't dove into wellness very much. They kind of touched the surface, but I think this is, something new for them. We've furthered our cause along by reaching out to, one of the senior people in that association and encouraging them to say, hey, this is a good thing for your group, and, can we present? And it worked out good that they took it back to the board and approved that we could have 30 minutes of a time at one of their meetings in June. And so we took them up on that. We're going to be presenting, the topic of, what kind of role the employer will take in employee wellness and how we can further that along.
Our group was initially tasked with figuring out how we, as a healthcare community, can more quickly and more efficiently adopt best healthcare practices so that more patients and providers can benefit from what others are already doing well. For example, there may be a certain practice or provider in the region that has great success in helping patients manage their diabetes. We wanted to figure out a way to efficiently and easily make whatever strategies this provider is using with their patients readily available to others who treat patients with diabetes. We decided an area of health that we wanted to focus on was childhood obesity. A provider in our area had recent success in this area of health, and we wanted to evaluate and replicate those strategies so that hopefully the region could benefit as well. It was interesting to us that there were so few organizations in town who have action plans in place to combat childhood obesity. We know that child obesity is an issue, and we know that many organizations have childhood obesity intervention as an initiative, but very few had that plan to do something about obesity, the plan to actually intervene. This is why we felt this was our opportunity to take an action plan that was having some successful outcomes and share it. The Family Fitness Challenge, which originally was started as a community-based child obesity intervention or prevention program, was brought to Bellamy Elementary in January, and the 8-week program was conducted with over 100 fourth graders. These children had BMI collection done at the beginning and into the program and were given challenges each week that included healthy habits that incorporated their family members. The program has shown a statistical drop in BMI in adults and children, and last year, 6-month sustainability data was seen by fourth graders who participated in the program. Just this past week, this program, the Family Fitness Challenge, that was done at Bellamy Elementary School was chosen to be showcased at a national convention in Seattle put on by Shape America. There was a great deal of interest by those in attendance in how they could bring a similar child obesity intervention program into the walls of public schools. Another endeavor that resulted in the collaboration of this group was the presentation by Janelle Rischetti at CHEC's 16th Annual Coastal Pediatrics Symposium. At this conference, healthcare providers were given practical approaches they can use in the clinic in regard to child obesity and a handout that Janelle Rischetti created for the Family Medicine Division at Wilmington Health. The handout was designed to aid providers in addressing child obesity which can be a sensitive topic to parents and children. Currently, the Wilmington Health Foundation and UNCW are working on posters to put in clinics around town and nurses' offices in the schools with the message to parents, "Do you know your child's BMI?" and a list of reasons as to why parents should care. This is an effort to get the discussion about children and their weight started by parents so that the healthcare providers are less likely to tiptoe around the issue.
It's been fun, in all honesty. When you think about it, we've done some neat things. We've gotten people to ask questions about how to make a difference. And they came to the table willingly and actually actively and really helped us think through some of these hard questions. And we're very fortunate to have so many great people in our region who are willing to take the time to help us work through these tough questions and hopefully come up with some good answers.